Hey, good morning. Good afternoon. It's 12 o'clock. It's 12 o'clock somewhere. It's going to be 5 o'clock somewhere soon, but at any rate, welcome to MagnaWave Office Hours. I'm Pat Seymour, the CEO of MagnaWave. I'm glad to be here with you. Come to you each Tuesday afternoon at noon. Used to do it at 9 o'clock in the morning to answer your questions with regard to MagnaWave, PEMF, devices, training, protocols, whatever your questions may be. I'm here to answer them. You can post the questions in your chat box if you're on LinkedIn, YouTube, Facebook, wherever you happen to be. Post your questions and then they will show up and I will be able to answer your questions. If you'd like to talk to me live, just send me a text to 502-599-9722 and I will call you back. That way I don't have anyone answering calls. So if you send me a text, I will call you back. This week, if you send a text and we want to visit, we'll send you a piece of MagnaWave gear for your use and to enjoy with the new logo and all of that. So give me a text, 502-599-9722. I'll call you back and we can have a discussion about whatever it is you might like to discuss with regard to MagnaWave and PEMF. Or certainly you can post your questions right into the Restream field. Tracy Walker's with us this morning. Dion is with us. So welcome aboard. We're also on Castbox this morning, which is the radio version. Chris will put the link in there if you'd like to go over to Castbox and listen to it as you drive or as you're working more like a radio. Also, just to bring you up to speed on a couple of things that are going on, we're getting ready. As you know, we've been on Roku TV. We're adding Fire TV, should be added today. I thought it was added earlier, and then Apple TV next week. So you'll be able to watch these programs or any other programs that we have, varying on small animal, large animal, bovine, sports therapy, integrative therapies. All of that is in separate channels on Roku, Fire TV, and Apple TV. You'll be able to watch in the comfort of your home. What we're going to do, the easiest way to do it, because it gets a little convoluted when you're trying to find the particular channels, is we have a page that's going to be on the website that you can go to that page. There will be a link that you can click the link and go to Fire if you use Fire TV. Click the Apple link if you use Apple TV, or certainly Roku, and then you can go watch. Also, we'll have available for you probably early next week will be individual apps. There'll be biohacking wellness apps, and you can watch them on the Android apps or the iOS app, and you'll be able to keep track of all the different channels in that fashion also. So we're excited about that. It's been a lot of fun setting it up, and we're growing it as we go, and we're getting more and more things figured out. But it's an exciting avenue. If you'd like to participate, potentially do an interview about your business or what you've done for wellness and so forth, I'd love to do that. Just let me know. Send me an email. We'll schedule a time to have a one-on-one personal interview about what you do, how you do it, what your interests are, that whole thing, and it'll be out there for the world to see. I was on I am still, Elaine and I are still on Jack Canfield's Success Channel, and it's been amazing the number of people that have reached out to us after having seen the program on Jack Canfield's Success Channel. So that's why we went to to do this ourselves and offer these channels available to you. So again, it's Roku, Apple TV, and the Fire Stick or Fire TV through Amazon coming up tomorrow. And so we're excited about that. If you'd like to participate, please do. Also, if you want to send me a text and get a piece of MagnaWave gear, send a text to 502-599-9722. I'll call you right back, and then we can have the discussion accordingly. Let's see if there's anybody in the area asking a question. Good morning. Carrie's with us. Idle Hour is with us. Carrie Collingham Collingham is with us this morning. And so we got a lot of folks here. So thank you for being here. And again, if you have a question put it in there and we will get right to it. There have been a few things that have come up. Certainly the question always comes up about metal. If someone's had a hip replacement, can you treat? Typically the answer is yes. You always want to test and make sure that the person is comfortable, but it's all right to typically we've not had any issues treating over metal implants or anything like that. The question was asked, have you flown with your Max lately? Anything I need to do? Well, if you haven't flown, if you've never flown with your equipment, of course, a lot of people haven't been flying no matter what's going on, but typically it takes a little longer for them to check through TSA because they want to look at it. They're going to swab it to make sure that it's not any type of explosive device or anything like that. They just want to make sure that it's safe. And if you check it, what you want to do, if you've got a newer, if you've got, well, now the Maxes have gotten smaller, but if you got one of the Maxes that we've had for the last couple of years that's larger, you'll have to check it. But what you want to do is take it through and check it at the gate. It gets handled better if you check it right at the gate instead of checking it in when you come into the airport, because it goes down the conveyors, gets moved around, put from carrier to carrier, could be dropped or whatever. So my recommendation is to check it through TSA. Always have a brochure with you, a veterinary brochure primarily, showing that it's a veterinary device and that it's not dangerous or anything like that. And so you want to just have good documentation. Check right through TSA and away you go. Been flying with Ours now for 15, 16 years, haven't had any issues. The only issue we ever had was in Dubai, where they thought it was a bomb. They weren't going to let us out of the country till we convinced them that we were there to see the Shah, and Sheikh Maktoum had invited us over and they let us go. So that's the only place we really had any issue with our devices. And we had no issue going into Dubai, but we had issue coming out of Dubai for a couple of hours. But at any rate, also, if you're traveling out of the country, you always want to have documentation that you own the machine, that you're taking it into the country with you, and then when you're ready to come out and you go through customs, you have documentation that it is your machine, that you brought it into the country, when you brought it, so on and so forth. There are some forms to fill out if you're flying internationally that are very accessible and very easy to do. And I've flown with the forms and without, and it's a little easier with the forms because they know you're taking it in when you go through customs and so forth. If you don't, then they kind of think, well, you bought this here in Canada or in Europe or wherever you happen to be, and you're taking it out of here illegally. You got to pay tax and all of that. So just make sure that if you're traveling internationally, you have all the necessary paperwork completed and you're ready to go when you get when you're heading out on your travels. But typically it's not an issue to check your device as you fly. Let's see if we've had anyone deep vein thrombosis. Will MagnaWave be beneficial for that? Certainly in an animal, or you always want to check with the doctor to make sure that everything is safe, but it's a circulation issue. Can you help the circulation? Will it break up the thrombosis? Not necessarily, or anything like that, but it's always good to check with your veterinarian if you're dealing with those types of situations. Also, Perthes disease in a child, that's where there's a issue with the bone into the sockets of the body, and it gets very debilitating, and circulation is often a key. So good blood flow and good circulation can help those situations, nourish the area, maybe keep it from getting worse. So those are always situations that we deal with, and that you always want to talk to your doctor when you're doing that. I had another question. Has anyone treated someone who has fluid in their calf? The doctor feels that it's water. Again, you're dealing with a situation that circulation can be beneficial. So you want to aid the circulation in the area, and the pulsing of the MagnaWave, the magnetic field into the area, can help relieve some of that and help move whatever it is, the fluid, the water, away from the area. So some very good questions, pretty basic as we go through, but it is something to certainly always consider and talk about when you're approaching how you want to use your MagnaWave. And that's something that we're covering certainly it's available on our YouTube channel. And if you go to the MagnaWave website, you can search testimonials by topic, and you'll be able to go on the Biohacking Wellness TV. You'll be able to go, as I said, we've got small animals, large animals, bovine, sports medicine or sports therapy, integrative therapies where people use MagnaWave along with their other therapies that they're using to further their success with their clients in the animal world, and in many cases in the human world as well. So always good to be able to find what you're looking for. The question is, have a boxer experiencing issues with scratching on her face and ears. She has a litter to 10-day-old puppies. Any tips for treating her? I did 8 minutes on low setting with my Julian tonight. Well, the situation is certainly if there's itching and around the face, that's an inflammation. And that's a situation that if you treat the area, you can relieve it. When I had my cataract surgery, I'm finishing my last bit of drops on my right eye, and I got 1 more week to go on my left eye, 2 periods of drops per day. I've used the machine regularly. I put the coil up to my face, and it helps. I think it's helped the flow through the eyes. It's helped the healing process to the point that when I went back to the doctor after my second eye was done, he released me for a month. He didn't want to see me in a week. He said, "You're seeing well better than I thought you would be doing. Your healing is moving along very well." And so he's pretty excited. He knows that I've been using the MagnaWave, and he was aware of it. But he's like, anytime you're with a doctor for the first time, it's, well, this is new, and I think it's helping, but you're doing really well. And so kind of like we're talking about the itching, my eyes itched, and of course you can't touch them for the first 5 days. You have to wear a patch or a piece over your eye so you don't touch it and don't break things loose. But I was treating immediately after my surgery. And on the first eye, I didn't do that. And I had what I called a rock in my eye. I felt that I had a rock in my eye for 10 to 12 hours after the surgery, and I started treating myself about 10 o'clock at night, and by 1 in the morning, the rock, as I describe it, was gone. On the second eye, when I came out of the doctor and got in the car, I felt I had this thing in my eye, and it was really bothering me, and I came home and I treated myself immediately, and within an hour or so, the inflammation was reduced and it was gone. I didn't have that feeling, so that's part of the thing, that we were just getting good blood flow, getting things going, and that was always exciting. Well, we have a message here from someone that would like to visit with us. The question is, I know we don't diagnose or treat, but I've got a friend recently diagnosed with BPH, trabeculation of the bladder. They want to schedule TURP. Any thoughts of how to use MagnaWave, house strength sessions? They have the Semi 5. Let me go get Stan over here and see if we can get him up here and we can have a little conversation. Stan on the phone here. Good morning.
Hey, Pat.
How are you?
I'm good. How about you?
I'm good. So you got somebody with, is it bladder cancer or bladder?
No. So it's enlarged prostate.
Okay.
And as a result of that, they're saying damage to the bladder, which is what that trabeculation is.
Okay.
And the doctor was suggesting for them doing the TURP procedure. So I was wondering if MagnaWave may be beneficial, and if so, how, with prostate, to utilize it, what type of settings you would do on a Semi 5, where you would position it, how long you would do the sessions, if that may be indicated for them.
Okay. Number one, certainly the prostate is becoming inflamed, interfering with the bladder, causing problems, and so they want to go and do the TURP procedure. My experience personally is that the MagnaWave totally controlled what was going on with my bladder when I went in, and they told me that when they started doing MRIs and ultrasounds and all of that along with it, they didn't like anything that was going on. I had about an 8-week period before the biopsy, and when they got to time to do the biopsy, it was dead. And ever since that time, now 6 years, I treat myself regularly. And what I do, and what I did, and I used the Semi 3 when I had mine, and you have the Semi 5, and I basically sat on the butterfly coil and the large loop daily. I would do it probably for 15 to 20 minutes each day. At the very beginning, I was doing it twice a day. But it was a situation that I just did it regularly, and it controlled the size, the inflammation, and certainly it had some result with the improved potentiality of improved oxygenation of killing or fighting whatever was going on there. And that was my personal type situation. We have had countless people who have had those issues that have used all of the machines, but again, the Semi 5 or the Semi 3, and I even use now the B2 that I use quite often as I sleep to control that. And I can tell if I'm getting to a situation, all of a sudden I'm having trouble discharging. If I treat myself, bingo, everything's back in place the way we want it. So the doctor's been very pleased with that. What I did with my Semi 3 is I treated on medium and high, and I would run through a couple of sessions each time that I would do that. And I did the difference because I didn't want the tissue to become familiar with what I was doing. So I switched up the coils and I switched up the intensities. And that's certainly how I would approach it in this type of situation. And so depending how long they've had this problem and how quick you can bring aid to the thing is certainly what you need to look at. If it's been a long time, it could be a little harder to reverse or harder to have some result with. Certainly we're not doing anything but helping the circulation to the body with the pulsing and the magnetic field to allow the body to better do its job. So that's basically how we approach it. So I would go after it. I would do it once a day if you can, or as often as possible. There have been people that have treated themselves just once or twice a week in a clinic type situation that over a period of time have been very pleased with the inflammation reduction, because that's basically what we're doing is we're setting the body up to better deal with inflammation, which is the root of most pain and most everything going on. So that's how I would approach it.
Great. I really appreciate it. I will let them know and have them give it a shot.
Okay, sounds great. Thanks for calling.
Thanks,
hey, send an email to support at MagnaWave PEMF and we'll get you some gear.
Okay, thanks.
Right. Bye-bye. Great question. And I shared a story last week about a friend who's been diagnosed with some issues of the prostate, and they wanted to do a very substantial surgery after the first of the year. And after about 10 weeks, when they went in and did another another MRI scan last week, they couldn't find it. They couldn't find what had been causing the problems before. And so they're just going to sit back and continue to monitor the situation. But they were very pleased with how things had progressed in that situation. So the prostate, we have a study. There's a study. You can find it. Go to the research tab. And there is a study that we did in Cuba utilizing the MAX device on prostate, also lower lumbar, knee pain, incontinence. We've done studies in those areas that we have available to us to share with you that's available. So that we are doing things. We're one of the few companies, us and the factory that we work with, we fund these studies and work with them on it. We're one of the few companies with sister companies that are doing some research with our devices. There's a lot of information that's been compiled over the years with various devices, all kinds of devices, PEMF devices, all different strengths. And so there's a lot of reports out there, but there aren't many studies that have been done with specific equipment. Now, the devices that are FDA approved for incontinence, autism, depression, the glioblastoma, brain tumors, most of those devices that are certainly FDA approved had specific studies dealing with their equipment, utilizing their equipment and coming up with a basis for those studies. So there's a lot of things out there. People ask me, well, I can't find it. Well, what people do is when they create a device and they're going to put it onto the marketplace, they may not call it this. For example, TMS, transmagnetic stimulation, is the same thing as PEMF, but they called it TMS, transmagnetic stimulation. And so if you go to look for it, you got to know what you're looking for to find their data, to find their studies, because companies don't want to give everything that they've paid for or worked very hard for or invested in, just give all that data to somebody else to potentially knock them off or something. But it's all there. It can be found, and there's a lot of studies. And you can go to the MagnaWave website, go to research, and you can put it there and find the various things that have been done. And of course, we're working all the time to improve the studies that we have going on and improve the positioning of the equipment that we have available. As you know, we've been approved Health Canada, still waiting for a couple of little T's and I's to be crossed for the CE mark, and moving down the road, certainly with the MagnaWave devices and the PEMF solution devices for use with equipment. Let's see, here's a question. Let's go bring it up. Ring a ding ding. Hello.
Hello, this is Shane.
Hey, Shawnee, this is Pat Zemer with MagnaWave.
Hello, how are you?
I'm good. Did you have a question?
I did. My question is this.
Oh, are you there?
Can you hear me?
Oh, you're breaking up. Let's try again.
Okay, let me move over here. So I have a MagnaWave Julian, and I've also been looking at the bemer horse blanket. I like that concept.
Okay.
I was wondering if you could explain to me the difference between those two waves. Apparently there's a difference there, and I'm not sure I completely understand it. And my other thought was, do I really need this blanket if I have a MagnaWave?
Okay. Now, this is not to disparage anybody's equipment or any other company.
Right.
Companies are different, products are different. When you look at the basic difference, the bemer devices and many other devices are called low voltage, low frequency devices. MagnaWave devices and others are considered high voltage, low frequency devices. So what that means is when you take a low power device, typically you're getting between 35 and 50 gauss out of those devices. With a MagnaWave device, with a high power device, you're getting anywhere from 250 gauss up to 6,000, 7,000, 9,000, 10,000 gauss, depending on which device you're using. And your Julian falls into the higher level of that in the 8,000, 9,000 gauss delivery, depending on whether you're using a paddle or a butterfly or whatever. The concept of the blankets to put it on the horse, I did that for years. I sold for a company called Centurion that had blankets. They were low power, and we could put them on the animals and they would relax the animals. They would do that, but to get a therapeutic value, they had to be used once or twice a day for 30 minutes to an hour every day, and it just took time to achieve what they want. For relaxation, which is beneficial to healing, and that they were wonderful. But when you come down to where you really want to get some result, they don't provide the quick result that we're accustomed to having with the MagnaWave, with the high power devices. And all this began to change at about the same time, back in 2007, 2008, when all of a sudden we moved from the low class 3 lasers to the class 4 lasers that were much more powerful, and they could provide a result more rapidly. We hit the scene at about the same time with our high power devices, and people were seeing results after 30 minutes or after 20 minutes of use with their animals. And so that's the primary difference. Do you need that since you have a Julian? No. Not trying to dissuade, but I'm just saying,
Sure.
no, use your, if you have the large wave wings, if you don't have them, buy them, because then you can do the whole shoulders or the hips of a horse and get the same quick result that you're looking for with the blanket. We've talked about adding a blanket to our line. The challenge is they may need more energy in the shoulders than they do in the hips. Well, quite often when you put a blanket on and you turn it on, you're getting the same intensity throughout the whole blanket. So you may not be able to turn it as high as you want because you're really pulsating in the hips, but you need more in the shoulder. And so whereas with your attachments that you have, you can move those large wave wings wherever you want them, and you can run them higher at one spot than you can in another spot as you go. So you've got what you need. Now, there are folks that might come back and think, I'm treating these 5 horses every day, and so I'm going to use a blanket. I don't need to do much with them, so I'm going to throw a blanket on them for 20 or 30 minutes while I'm doing something else. That's okay. But do you need to do that? Do you need to spend another $5,000 or $6,000 getting into my recommendation at that point would be to drop back and buy a Soul or something like that, or a Semi 3 or a Semi 5, and for the same kind of money, and you're still getting 10 times the power. And approach it from that perspective.
Okay, wonderful. Thank you. I appreciate that explanation.
Okay, hope that helps, and send support at MagnaWavePMF.com. We'll get you some gear.
Oh, wonderful. Thank you.
Bye-bye.
Bye-bye.
Great question, and it's always interesting to answer those questions. And there are people that have used low power devices and gotten very quick results very handily, and that's wonderful. We don't want to take anything away from any devices, but when you get into the power spectrum and you want something more rapidly, more power will help give you that type of situation. Okay, here's another question. Let's bring Rianne in. Rianne.
Good morning, Pat. Or hi, I guess it's not morning there.
Yeah, good. Hello, how are you?
I'm good. How are you?
I'm super.
Good. Real quick, and I know this might be a good conversation to have with Elaine as well. I'm trying to get in touch with her, but I was tossing around the idea of hiring not a practitioner, but hiring an assistant that can go with me to these barns and use a machine and treat horses with me. Is that something that I need to have an assistant that's working with me? Do I need to put them through the certification program to be certified, or would I be okay to just have an assistant that goes with me that I can supervise and kind of tell her what to do? Or no, I've seen veterinarians do the same thing. They may hire somebody on to work with them before they become a vet tech, and they're doing certain things to assist them with their procedures. And you could do the same thing. Does your assistant have to be certified? No. I would think if you got to the situation that you acquired a second or a third machine and you're going to have that assistant going out on their own to do work for you, then you may want to have them certified so they certainly understand everything that's going on. They know how to talk. They know all the answers that we're looking for. If you're there with them and they're simply aiding you in if you're using 2 attachments, you manage this attachment, I'll manage that attachment, and you're working with them, showing them what to do. You can do that very easily, and you can even go through some people to where you're looking for somebody who really understands and wants to be your person. And so that gives you don't have to make that heavy commitment right at the get-go. You know what I mean? Okay, I just wanted to make sure that there wasn't any rules or there was no liability to having someone not certified actually, because I do have 2 machines, so she would have her own machine, own attachment, and would be working a separate animal at the same time that I'm working a separate animal. I just wanted to make sure that I was safe, quote unquote, safe doing that.
Well, plenty of people have done that, and again, they work through that. And if you have your liability and your insurance and things like that, your insurance company may say, well, we want you to have this person trained. But from the initially to look at it, you can move right along, make sure you're comfortable with the person, and then educate them as you feel that they need to be educated.
Okay. All right.
Okay.
Thanks.
You're welcome. Send us an email, support at MagnaWave PEMF. We'll send you some gear.
Thank you.
Bye-bye. Okay, so always good questions about how to expand. Elaine is doing a whole class now, and I don't know when the next one's starting, but they've been pretty much sold out as far as the number of participants per class. She limits that so she can give the individual attention to all the people that are participating, and they're dealing with things like that, expanding your business, marketing your business. What do you need to do social media-wise? What do you need to do with your website? How do you upgrade things? How do you present yourself? How do you answer these questions? All of that is being covered in her classes that she's doing, and so that's something to certainly look into if you're interested in doing that. Chris might put some the link in the site for those of you who want to learn more. But certainly, if you have questions about that, put them out there, and we will certainly answer them. Let's see. So Lee's got a question. Let's bring her up.
Hey there.
Hey Lee, how are you?
I'm doing well. How are you?
I'm fine. I'm fine.
Can you hear me?
I can.
Well, good. I am celebrating to some extent being almost a year out of a traumatic brain injury diagnosis,
Okay.
which I have successfully treated with MagnaWave and also a neurologist, chiropractor, and I've gone through a lot of reparative, months and months to get to a point where I feel, I'm ready to ride, I'm ready to compete, not afraid. However, one of the things that's still ongoing is if I put the double butterfly behind my head, and I often do it when I'm driving. I have a generator,
Right.
plug the machine in, I put the coil behind my head, and on the right side, my eye will twitch. But on the left side, it's still completely blocked. There's no reactivity in that. I can move it a little bit and start to get a little bit of reaction through, basically kind of through the skull. But I can't really say what that is. Why is it only doing it on one side?
Well, certainly there's probably two things that this could be. The right side needs additional stimulation, just like when you go over a muscle, you'll get some movement.
Yep.
So you're still developing a stimulation to the right side, to the right eye, to that area, and so the fact that it needs it, it's telling you that by twitching.
Okay.
And as opposed to the other side, but it could also be if it's a situation that the left side was damaged a little more severely. Go ahead.
Yeah, well, I mean, that's the thing. I'm not sure which it is, although I do know that the right side was swapped with the left side in terms of the neurological. For example, you think left side, right side, they switched. So somewhere in that brain injury, they switched sides. So now I'm doubly confused as to what happened and where I am. But obviously, the treatment is working, and I'll just keep at it and see, when that resolves one way or another. But I was just curious as to your input on
Well, and that's what I was going to say. That was the next place I was going to go. When it switched, if you had more damage on the left side, if the nerve was damaged more severely, it may take much, much longer before it comes back to where you want it. And so over time,
that's kind of what I'm thinking. I'm actually thinking it's not that the reactivity is where I need it. It's actually that the lack of activity is where I need it.
right. And that could very well be, and you could discuss that with your docs and so forth. But that's not uncommon in nerve type situations, that it's just taking a long time to regenerate itself, to get back where where you'd like it to be. And in some instances, I hate to say this, but in some instances that never happens because of the damage. But if you're healing and things are getting better, that is a good type of a good situation. Have you tried, when you're not driving, certainly, treating that left side from the side of the head or from the front?
Oh yeah, and it's painful. I mean, that's the thing. Certain parts of treating my skull are actually excruciatingly painful if it's up too high. So it's all, it's very interesting for me to be treating myself. And the original concussion that I had was over 20 years ago. So some of this is old. Some of this is, was based on a new series of concussions. Thank you, horses. But
Yeah.
but I'm dealing with a 20-year-old concussion where I was med-flighted, from a riding accident, and all they did was send me home the next day. And we did not have any kind of help back in the day that we do have now to treat these, right away. So I'm grateful to MagnaWave, even that, that I am where I am, given the series of concussions, because I do not want to end up where I could end up having a series layered one on top of the other.
Right. We are doing a study. Of course, it's kind of become confusing with the COVID, but we're doing a study at the University of Colorado with Dr. Larry Lyons on concussions. And he's doing brain age scans and recovery type scans. And one of our associates who's working with him, Sean, could maybe put some information to him about your case, and he might be able to get provide us with some additional information.
I would be happy to speak with him and get any information and be a, just like my dog was a test for the CCL. I did one CCL tear with just MagnaWave, and then she injured the other one, and she has plates and pins and screws, and she's my test dog because she's now 9, and I can't tell the difference between the she's a big 90-pound dog.
Sure.
I can't tell the difference between the one that had the $3,500 surgery and the one that I just healed with MagnaWave. So I've got a lot of studies going on. It happens.
Well, that's great. Well, I'm glad you're doing better. I think that's wonderful. And you could reach out to Lee at the office, and then she can put you in touch with Sean, or we can work that out to get the proper way to make that communication and at least just provide the information. And Dr. Lyons is very beneficial and responding to our questions, and he keeps us up to date of where his study is. So that'd be something that we can look at.
That sounds great, Pat. Thank you so much.
Hey, Lee, nice talking with you as always. And support at MagnaWavePMF.com will get you some gear.
All right, thanks.
Bye-bye. Wow, great questions. And we are working with Dr. Lyons, University of Colorado, on brain injury and concussions, and the results thus far that he has shared with us have been just wonderful. And certainly we want to use that information as we move down the road with the FDA and how to use our equipment and so forth to provide credibility and to certainly be able to help people with what they've got going on is what we like to do. So if you have a question, there are some questions in the chat box. I'll come to those. Let's see, but we have one more phone call here. I wanted to see how I get okay. This will be, I need to put this, let's just bring them up real quick.
Hi, you've reached Lisa DeSantis.
Okay, well, we tried to reach, the question was, how do I get trained to use and buy a MagnaWave? Okay, you contact the office and they will
if you can do it online and give them the information, or you can call the office direct. The number's on the website. It's 833 MagnaWave, and tell them you want to learn more, and they'll put you with a product specialist to answer any questions that you may have about getting trained or how to use the device. So we're certainly here to do that for you. So that would be the easiest way to do it. Fill out a form on the website, or give us a call at 833 MagnaWave and tell them you want to learn more, and they'll put you again with a specialist who will help you answer your questions. We had the question, can I use MagnaWave with detached retina? Well, certainly you want to be dealing with your eye doctor on that situation. Severity as to what pulsing could do with that. One of the people watching, Bill, pointed out that you'd be interesting to see with the observation if it would go ahead and detach, or if it would help it to keep it from detaching and help it and potentially heal and strengthen itself. Well, certainly that's where the conversation with the doctor is always important to do. Can the improved blood flow to the area? I mean, there are many times where we're dealing with situations. For example, if you want to treat the eyes, you could simply lay a mat at the back of the head and treat the head. You're treating the overall blood flow of the head, of the body. You could treat the lungs. That good oxygenated blood is going to go through your nasal area, through your eyes. Can that be beneficial to any situation that you're dealing with? For sure. Just improved blood flow, improved oxygenation, wonderful to help the body be in a better position to heal itself. But certainly it's always one of those things that you want to talk about with your doctor. So Bill, thank you for helping out there. Is there a max amount of time that you should do a single treatment on a horse? I had a client tell me a PEMF provider does a minimum of 1.5 hours per session. That's a question I've been asked many, many times over the years. When I began treating, when I first started treating myself, doing horses, I was treating 8, 10, 15 horses per day. My average treatment time per horse was about 20 to 30 minutes. The logic was, as I was just talking about with the eyes, if you treat the lungs, you're going to treat the eyes, and you're with good oxygenated blood and improved blood flow, allowing the body to better do its job to heal itself. So I would treat the upper body of the horse and help good blood flow, help hip movement, help range of motion, all those types of things. But then I would come back, if they were having leg issues, I would treat a knee or a foot or a hock, whatever the situation may be. So there was no regulated time. I can tell that over the years, practitioners would get involved and they would love what they're doing, and they'd love dealing with their animals. And so they'd treat them for an hour or an hour and a half. Then the question would become, well, I'm treating these animals, and how long? I can only treat 4 or 5 a day now. What am I going to do? Well, they're coming in to cut my grass because I'm working from home. So if you hear power tools, you're going to hear the blowers. But at any rate, you can always give more time than you can take time away. If you're treating for an hour or an hour and a half when it comes to these animals, and it's very difficult to take time away from the animals or from the people. Well, I'm going to just wait. He'll be done blowing here in just a second. I can probably reverse the camera and get a shot at him blowing off the yard. You know, we're working from home now a lot and doing all of this. And if I'd have known they were coming, I'd have made the cake and given it to them, told them to go out and do the front yard first. They're almost finished here. I'm certainly sorry for this interruption that we're having with the blowers cleaning off the back. Let's see if I can flip this around here and have a look at what they're doing. There he is. There's a microphone there. But they're back there blowing, if you can see it. I didn't see my yard. Okay, let's come back. I think it's a little better. But at any rate, those are the situations that you're dealing with when you're talking about length of time. Do you have to do it an hour and a half? No.
certainly not an issue. And there is no set time. As I pointed out when I began, I was pretty well treating 20 to 30 minutes per animal, and I'd always ask if there were issues with the legs. And I would explain that. That's something that people need to understand. They're saying, well, you're just treating the top of the horse, you're treating the top line, the hips, neck, shoulders. What about the legs? And my question would be, are you having problems with the legs? No, everything's great. We're doing good. Well, where's this good oxygenated blood going to go? Well, it's going to go into the legs. It's like taking a vitamin. You take the vitamin, it nourishes your body, and it goes to where it needs to go, and kind of does its job. And so it's the same situation as you're dealing with the horses that you're treating, or the animals that you're treating. So, and you know, if you have a customer and they're used to having their horses treated for an hour and a half, and you're charging a similar amount of money, you might have to spend some more time until they become educated or they understand what is happening. But no, you do not have to go an hour and a half. I'm not saying they're wrong in what they're doing. People do different things. They have different procedures, different protocols for how they're doing with treating their animals and so forth. So great question. Hope that helps. When using the splitter, do you lose any effect of the treatment by using 2 coils at one time? I have a Julian and have never had to turn it up to full power. Okay, and you pretty much kind of answered your own question there. If you're using a splitter and 2 coils, you have more coil. So in theory, you are going to get less power to each coil. Now, if you have both coils, let's say you're using 2 wave wings and you have it on the hips and the shoulder of a horse, and as you turn it up, you will not get anywhere near full power using the large wave wings because of the amount of tissue that you're stimulating. So you're going to turn it to what looks good and is comfortable on the animal. So you're doing good. If you have a situation that you want to treat a knee with a butterfly and put a large loop or the wave wings on the hips of the horse, well, you're going to run into a little bit of an obstacle, because if you turn it up for the knee, you're going to get too high for the hips. And so you don't necessarily want that type situation. But so as a rule, you are diminishing your power a little bit. As a standard, you rarely get to where you're using all of your power anyway. What I would typically do in that situation is I'd treat, if you're using the butterfly on one foot and the hoof box on another foot, treat them both, turn it up as high as you want to turn it, you're going to get good result. If you're going to use 2 attachments and you're going to use one on the hips and one on the neck, then do them at the same time, because you're going to get more of a similar type of reaction in those areas. But if you go to where you want one high and one low, that with a splitter, that causes a little bit of a situation in how you want to apply the attachments. And again, a lot of this is explained in the training, but if you have a specific question, please feel free to call the office, talk to Teresa or to Aaron, and get those specific questions answered. Okay. And they just put up the study on prostate issues. Good. Let's see here. If you are a certified practitioner and visit a practitioner portal, we have plenty of, they're talking about research that you can use. That's from Aaron. What is the different gauss in the different coils? Well, to better explain that is the coil. If you're dealing with let me come over here. Okay, no other calls. If you want to talk to me, 502-599-9722. All right, what is the difference in the gauss in the coils? So if you have a small coil, so if you have a paddle, and the way it's made, it's very tight and it's very focused. So when you deliver the energy from that coil, it's going to be much higher. You're going to get much more energy out of that paddle coil than you are out of the large loop, if you will. So what happens is we measure the machines on their maximum output that's available. So we'll use a paddle, and we'll say a machine can go to 9,000 or 10,000 gauss, just for conversation's sake. And if you take that same machine and you go to the large loop instead of the paddle, you won't get 9,000 or 8,000 gauss out of that particular thing. You might only get 7,000 gauss. Or you might drop down and where you're using the large wave wings, and they're real large and they're covering a lot of tissue, and you get a lot of movement because of the tissue you're covering. Your amount of gauss may be much lower, down in the hundreds if you get into using the large loop. So it varies from coil to coil or attachment to attachment, and it plays out with the amount of tissue that you're stimulating in those situations. And so that's what happens with the coil. The coil itself determines how much gauss is being delivered. So, for example, the machines can go, let's talk about the Max, for example. The machine can go from 250 gauss to 10,000 gauss or so. All right. So what happens when you're using a large loop on low? Well, you might only be getting 200 gauss out of that device. As you turn it up, you might be getting 500 gauss, 800 gauss, 1,000 gauss, 2,000 gauss as you turn it up. But then you take and put the paddle, and on low, the paddle may be generating 500 gauss instead of 250 because of the way it's made and the way it directs the signal. So I know this is confusing, and I know that some of them as well, it gets kind of convoluted. Here's the deal. Put it on and treat. Just put it on there, put it at a comfortable setting and treat. If you're dealing with something that you want more energy, then use a smaller coil and put it on the area and put up your intensity or turn it up a little bit to where you're comfortable. The animal is comfortable and you're putting more energy into the area, just like you'd be taking more vitamin C, if you will. And basically it sloughs off. We always talk about 10 to 15 minutes being the magic number or the good number to go. If you go longer than 15 minutes on a shoulder, it's gotten all the energy that it needs right now. If you want to come back in 6 to 8 hours and put some more energy in there, okay, but you don't need to. So a daily treatment or every other day or every third day, depending on the animal. The animal will tell you where they are with the treatments as you're moving ahead and treating them. So I hope that helps with regard to the difference in gauss. And a lot of that information is available to you in the training and on the websites, and to get the various gauss levels that are good. Okay, Bill. Good, Bill. I thank you for enjoying. Let's see. Aaron's putting, what difference in your RX? Your muscles work differently also, especially those that accommodate for distances. What is the difference in your RX? I don't exactly know what he means by RX. Try to clear that up for me a little bit, Bill. Maybe I'm missing something. Christy asked, good afternoon. Interested in more info about the HydroWave. I read a little bit about, would love you to explain how it works and how often to take it. Would it be beneficial to give a bottle of water with it when I treat people? If only treat them one time a week or less, would it be a waste of dollars? When you're treating and you want to hydrate, regular water is fine. We're not dealing with hydration is more important than anything else that's going on at that point. The HydroWave is a method by which they take the oxygen that's in the water and they go through a process. They'll put some nano-sized particles of silver into the water, basically. If I'm giving you the recipe, they put some silver in the jar, and then they put it through a process, and the oxygen that's in the water clings to the particles of silver. And when that happens and you ingest it, it can go past the blood-brain barrier, get into the bloodstream, and potentially attack bacteria, potentially attack negative bacteria that could be causing problems, that can be causing disease. So that's the real beneficial use of the HydroWave. Some people use it, they mix it with good water, and they'll use it for eye infections, or they'll use it for open wounds as an over treatment to help clear up the silver and the oxygen helps clean things, helps keep things in a position that they're supposed to be in. Would I spend the money on HydroWave to put it in a bottle of water to give to someone that I'm treating with the MagnaWave? No. Use regular water. Now, if this person is experiencing something, if they're having some infections or they're having something going on in their body and they want good oxygenation, improved oxygenation in their body, that's where the HydroWave can be very beneficial to their overall health as a supplement that can help them in that type of situation. There are some testimonials on the website that talks about the HydroWave, but that's basically what you're doing. I take it daily. Now, I forget a lot, but I take it daily. I'll mix a 1/2 ounce of HydroWave with a 1/2 ounce of water and I'll just drink it. I'll move it around in my mouth so it can potentially absorb into the mucus tissue and so forth. Sometimes I'll gargle. I'll gargle with it if I've got a little sore throat or something going on. I've been having a lot of allergies, and I had my doctors check me because I'm certainly in the COVID. I want to make sure everything is good. So I've had an allergy in my throat and a coughing type of situation. And as long as I take my Claritin and stay with it, then I don't get that little tickle in my throat that the allergies are causing. And I had it all checked with an eye, ear, and nose guy. But you certainly want to do that. But what I do is I take it and I gargle it and then I swallow. When I had my prostate situation, I was doing the MagnaWave every day, and then I was taking probably an ounce of HydroWave each day, and to help the oxygenation in the body, to help move things along, to help my situation. It all worked, and I'm very pleased with how that went. So so I hope that helps with the HydroWave and how to use it. UCI. I still need to look that up and be a little more clearer on that. My horse has bad casein cellulitis, has his fever broke, but still very swollen. Was afraid to use MagnaWave on him. What do you think? Certainly check with your doctor. But if you have a situation that the fever has broken and you want to improve the blood circulation and the comfort for the animal, you can certainly do that. Again, it's to always talk with your doctor, and it will help relieve the inflammation. You're not going to make the inflammation worse. We are basically deal with inflammation reduction when we start talking about these animals and how this equipment is used for inflammation reduction. Cellulitis is certainly a buildup of fluid and inflammation, and it becomes swollen. So anything you can do around it, if you're going to treat the area, treat above it, below it, and around it, as I often say, to clear the highway. So when you work on the specific area itself, you got a good flow of ways for things and places, for things and fluids to travel to. All right, I hope that helps. Kathy asked, I was treating a friend for TMJ for 4 days straight, and she came down with thrush. Would I continue treating her? Was thrush a result of treating the TMJ? No. I would let her get through that. Obviously, it is possible to treat something and you bring something to surface that's there by virtue of the flow and what's happening. You can, and we quite often have that in animals, that they're having a situation, we treat them, and all of a sudden something that's, as you know, our animals, you get on your horse, you ride great today, everything's wonderful, you come back tomorrow and the animal can't walk, but it's been building for weeks. And all of a sudden it's there. And so you'll have those kind of things that all of a sudden show up. Let that be dealt with a little bit, brought under control, and then come back to treat. I don't know how long you're treating the TMJ or what you're doing. I would do very moderately for 5 to 10 minutes and maybe do it more often from that type of situation. Boy, we got a lot of good questions and time is running close. Okay, so Aaron gives a good response there. Thrush is an infection of the central and lateral sulcus of the frog and the horse's foot, most often involve bacterial infection, occasionally fungal infection. MagnaWave would not cause the thrush, and it's safe to continue using the MagnaWave for your TMJ. There you go. Aaron's on it. She's got it, and she's been doing this for a long time as an aid to me and the rest of the people here at MagnaWave. Okay, let's see. A lot of good questions. We are about out of time. Aaron's been getting some of the answers there, so we certainly appreciate that. And we're glad that you are with us. Let me make sure that there's nothing else over here. Everything looks good there. Okay, let's see. I think we're in pretty good shape. Anything else from you, Chris, this morning? Nope, nothing else from Chris. So I want to thank you for the questions. They've been great. Always exciting to have questions. This program will also be available on the Roku channel, Fire TV, and Apple TV next week, and certainly on the MagnaWave pages on YouTube, and certainly in the areas of the
MagnaWave website. So certainly glad you've been with me. Questions were great. I always enjoy that. I like to be tested, and where I have to go do my own research again and more often. So it's always fun. But thank you for being with me and with you, all of you who are here, or with you also. Wave on to better health. Have a great week, and we'll be back next week with MagnaWave office hours. Thanks a lot. Bye-bye.